Okay, we are live. Good afternoon, everyone. Today's session is going to be really very helpful, and it's led by Dr. Tina Thomas from Apollo Cradle and Children's Hospital. She's going to talk about My Health, My Right, health management of a woman 20 years to 60 years. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Thank you. Good afternoon, everybody. So, we are going to talk today on My Health, My Right, health management of women 20 to 60 years. So, since we are going to talk about health management of this year, we will start as per the years. So, 20, 25, 30, like that, we'll go. Okay. So, for everybody's health management, there are three basic things that is very important before we look into health management. What are preventive methods to go into bad health management? So there are three basic things. One is diet, two is exercise, three is attitude. So diet means breakfast should be like a king, lunch should be like a normal person, and dinner should be like a beggar. So that is what it is, and a very high protein, less carb, almost nil fat. Cheating is always possible, but then this is what we have to keep in mind, that a proper diet, a balanced diet should be part of our meal always. So that is one about diet. Second is exercise. So minimum of half an hour exercise 3 or 4 times a week is mandatory for everybody for a good health management. It depends on how you are looking forward to losing weight. If it is weight management, then the exercise management goes different. But otherwise, for a normal individual, just to be healthy, half an hour, 3 to 4 times a week is mandatory. Any form of exercise which you prefer can be walking, swimming, jogging, anything, any form of exercise. Third thing is attitude. Attitude being most important part of it. So if we take life in a positive stride and health in a positive stride, then everything works out for better. So instead of cribbing that this is not correct, that is not correct, this is not happening, take everything in a stride. Every other person is landing up into some health issues in life, and they have to handle it. So unless we learn to handle things in a proper, better way, things will not work out. So I start off with the talk with the topic, which is the three basic things which is important for a healthy lifestyle, and that is diet, exercise, and attitude. And we end the topic with that only. Okay. So now we do health. We'll talk about what all is required. So we start off from the age of 20 years and above. So basic thing what you have in from 20 years and above, you are looking into something called prevention. So first we'll start off with prevention. Prevention, by 20 years, we expect all girls to be vaccinated with cervical cancer vaccination. So cervical cancer is the cancer of the cervix. Cervix is the mouth of the uterus. So any cancer growth in the mouth of the uterus is called cervical cancer. Only one cancer has a vaccine, and that is cervical cancer. The best age to take cervical cancer vaccine is before sexual activity. So it is there in the WHO vaccination card by 9 to 13 years. So if you are taking the vaccine before 16 years, the dose is only 2 doses. But after 16 years, it is 3 doses. So this vaccination will bring down the risk of cervical cancer by 75 to 80%. So this vaccination is good to be taken by all girls. So now you have crossed 20 years and you are vaccinated with cervical cancer. That is the only vaccine which is available. So that is done. Now you move on. You move on in life, and then the frequent problems that we have from 20 to 30 years. The most important is excessive foul smelling discharge or white discharge, or vaginal itching or anything which is related locally to the female genital part. So, a vaginal itching or any excessive discharge needs to be seen by a gynecologist. So, all discharges which are, so when you get your period, the first half of the period, it is a watery thin discharge, and the second half will be little thicker discharge. So this works same for everybody. But if the discharge is too much, or it is foul smelling, or it is colored, or it is curd like, or it is causing burning or itching at that place, then needs to be seen by a gynecologist and maybe treated for infection. So all discharges which are abnormal, any spotting in between the period, all this needs to be checked and treated. Now, second thing which we go on this age we see is irregular periods. Now, irregular period can be just a small variation in lifestyle or a stress based. You are writing some exam or going through a proper stress levels in your workplace, and then the periods get delayed or come a little early. It is all fine. So, averagely, a normal cycle is 28 days plus minus 7 days. So, anything which is 28 days plus minus 7 days is a normal cycle. You don't have to take treatment for it. But anything beyond that is irregular, which needs to be checked. What is the cause? But once in a while, if you have a little irregular cycle, it is fine. But it is regularly irregular, again needs to be checked. To get pregnant, you need monthly periods. Then only the hormones are normal to release monthly eggs. But to protect the uterus, if you get once in 2 months also, it is fine for the uterine protection. Now, so irregular period now, as I told you, if it is once in a while and that is taken care of, and you are having a good exercise weight balance, then probably it is just a single episode, need not be done anything, forget it and move on. But if it is regularly becoming irregular, then needs to be investigated. You need to do a thyroid test to see if the thyroid levels are normal, and in case abnormal, needs medication for that. So thyroid is something very small disease. Need not worry about it. Just have to medicate yourself for it. If it is because of your overweight, then exercise needs to be done for your irregular cycles. But then we also come across nowadays very much a condition called polycystic ovary, PCO. Now, PCO is a hormonal imbalance. Um, that is not a disease. So the PCOD term is completely out. There is nothing called PCOD. It is PCO or PCOS. Okay. So PCO is polycystic ovaries, which is hormonal imbalance. It is not a disease, so there is no cure. A person with PCO is usually born with a PCO gene. Like if I'm born with a gene for black eye, I can't change the color of the eye, right? Only unless if I put a lens. So like that, a PCO gene person is born with PCO gene. But PCO gene present doesn't mean that I have PCO symptoms, right? So at different point of life, people come with PCO problems. That is because of the change in the lifestyle. So when the lifestyle is good, the PCO doesn't show up. When the lifestyle is bad, the PCO shows up. So that is how we can see people of my generation, my age would have, I landed up into PCO at the age of 26, 27. My daughter lands up at the age of 15, 16. So it is the lifestyle change. So the worse the lifestyle, the bad the PCO. The better the lifestyle, the lesser the PCO. What does PCO cause? PCO causes irregular periods, number one. Number two, increased facial hair, weight gain, obesity. Then acne is for some, not for everybody. Some may have acne, some may not have acne. Then, mm, then the difficulty in getting pregnant. So fertility issues. So these are immediate problems of PCO. The later problems of PCO can be high levels of cholesterol, blood pressure, diabetes, uterine bleeding, uterine cancer problems. So these are all associated with PCO. How do you deal with PCO? So the treatment of PCO. The treatment of PCO includes two things only, two ways of treating PCO. One is lifestyle change. Other is tablets. So lifestyle change includes 1.5 hours of good exercise, a very high protein diet, and losing your extra weight, whatever is there. If you've lost 5 to 10 kgs of weight, PCO vanishes. But then you maintain the weight. If you get back that weight, then again PCO comes back. So, weight management, high protein diet, exercise. This is one way of treating PCO. The second way of treating PCO is tablets. Tablets can be hormonal pills. So when you put yourself on hormonal pills, then PCO gets corrected perfectly well without any problem, and the periods will be regular, the facial hair will come down, all these symptoms of PCO will come down, the darkening around the neck, that is part of PCO, that all will come down when you have on hormone. But when you are on this hormonal treatment for 6 months to 1 year, you have to shed down that extra weight that is there. If you have shed down at the end of the treatment, then the treatment will work. Then you don't need further treatment, and then the maintenance of your lifestyle works. But otherwise, again, it will come back. So that is one thing. And second is non-hormonal medication. So there are medication like myoinositol or metformin, which is used for non-hormonally treating PCO. So they just help you. They help you to bring in everything. They don't make it to a level 0. For that, you become normal to help you. So how you differentiate is when you put you on hormones, you are a normal self and you do everything and cut down your weight. But if you are on non-hormonal, you have to put in effort, do everything. Non-hormonal tablets just help. So that is PCO. Now, last bit in this PCO is there are some patients who are thin PCO, people who are thin PCO. Fat PCO, losing weight helps. So thin PCO, losing weight doesn't help. Then the treatment is taking hormonal or non-hormonal tablets based on how well each thing works for that particular individual. So that is PCO. Once you correct it, maintain your exercise level, maintain your weight, and periods are regular, it is coming down. Patients will say, just see the size of the cyst and say how bad the PCO. No, cyst is not there. These are all follicles. So there are more number of follicles and look like a bunch of grapes in PCO. And in a normal person, they are not there. That's all. There's no cyst there. It's a misnomer. So now, how severe the PCO is depends on how irregular the period are. The more irregular the period, the more bad the PCO. So I told you now about PCO management. And then that is how the irregular period corrects. Hormonal imbalances play part in this. Where there is any hormonal imbalance, again, hormonal medications have to be given. So now we have gone from 20 to 25 years with all these period issues. Then obesity has, I told you, weight loss is the management of half the problems in life. Then we have also discussed about the infections and sepsis and whatever at that age. Now we move on from 25 to 30 year. What next? Those who have missed their vaccine should take it as soon as possible. Once you are sexually active, now we expect after 25 you would be sexually active. In case you are, then from the day from 3 years after you are sexually active, 3 years from the time you are sexually active, you have to start a test called pap smear. Pap smear is again a screening test for the mouth of the uterus of the cervix to see any changes which may lead into future cervical cancer. Why we have to talk so much about cervical cancer? Because though there is a vaccine and though there is a screening test to pick it up 5-10 years before you actually get it, but still in India, cervical cancer remains the most important, most common cancer that we see, which is rarely in developed countries. Okay. Now breast has taken over, just taken over, that's all. So still cervical cancer is first and second position with breast, and that is how. So this becomes very important for vaccination, and the pap smear to be a screening technique every now and then. So if you are sexually active, then you start the pap smear 3 years after you are sexually active. So if you are sexually active at 18, then you start it at 21. If you are sexually active at 25, you start at 28. So like that. So 3 years after sexual activity starts, you start the test called pap smear. It is done once in every year. It is done um, once in a year for 3 consecutive years. It is done, and if the 3 consecutive pap smears are normal, then you need to do once in 3 years till 65 years of age. So that is how pap smear needs to be follow up. Even if you have taken the cervical cancer vaccination, you need to do a pap smear. The pap smear, 3 years after sexual activity, you start the pap smear every year for 3 years. And if all three are normal, then once in 3 years till 65 years of age. So that is the pap smear. Now you have started that with your age. The pap smear has taken over and started up. So that is then again, that is all. These problems. Then you are looking in. You have the 25 to 35 years. You are looking into pregnancy. So now, pregnancy, if you ask, ideally the best age to conceive is 22 to 29 years. That is the best age is 24 years if you say single age, but 22 to 29 years. But with our career and education and all, we are delayed. So we say that after 35 years, the risks are high. So best age is 20 to 29, but after 35, the risks are high. So we should be in mind to plan a pregnancy before and complete all our pregnancies before that. Otherwise, risks are high, but anyways, it's not that we can't deliver and we can't have a baby and all that. It can be managed. The best age is like this. So from pregnancy point of view, what you see pre-pregnancy thing is pre-pregnancy again you have to maintain your sugar levels and your thyroid levels. So pre-pregnancy counseling will include maintaining a good sugar level and a thyroid level. If those are normal, then start off with some good exercise so that we can continue in pregnancy, because exercise management very important in pregnancy. Third thing is start folic acid. So folic acid is a vitamin. It's a water soluble vitamin which is very necessary for the brain and spine development of the baby and to prevent miscarriages. So it has to be started 2-3 months before you get pregnant. So start off with folic acid, and the time frame which is best when to conceive is the ovulation cycle time is, if your periods are regular, then day 1 is starting of cycle. So day 10 to day 20 alternate day sex, that is when it is the best time to conceive. So day 10 to day 20 alternate day sex. So this is your pre-pregnancy thing. Now pre-pregnancy thing is over. Now conceived pregnancy anyway. There's no point in taking entire thing during the pregnancy. Basic thing in pregnancy, one, there is no bed rest unless it's a high risk pregnancy, like you have been bleeding or previous early pregnancy losses or late pregnancy losses. They are all high risk pregnancy, but otherwise a normal lifestyle with good exercise level, a good diet, with avoidance of smoking and drinking, and is the basic thing that you need during your entire pregnancy. And the various tests which your doctor helps you, asks you with, go ahead and do to see that the baby is fine. And then the pregnancy progresses. We reach delivery. It is good to deliver vaginally, but depends on your condition of the baby and the mother. If both are fine and vaginal delivery happens, it is good. If it doesn't happen for some reason and you land up into C-section, also it is good. Both patients, whether normal delivery or C-section, at the end of 2 months both are equal and both can do all type of exercises and everything at the end of 2 months, unless there is any other high risk factor which is coming. So at the end of 2 months of delivery, whether vaginally or by C-section, both can start off all exercise and a normal lifestyle. So then we've started normal lifestyle. Now we have children also. We've done all through and everything. Life's going good with all the exercise and the diet and things. Now, what are we post delivery going to face is something called postpartum depression, which affects many people now. So, because why this is increased now is because till that time, a girl is very active, studying, oriented, working out, going out every day, coming back and talking to many people. And then suddenly, and with the glamorous hospitals that we have for mother and child, that adds on to your all these things. And then after 9 months, immediately after delivery, you've just left the patient, you left the girl with the child. Manage now, and only thing you give her is nothing matter but good to eat, don't take her out, don't meet people, nothing. You left her in a jail with the kid. So then that is not the criteria. Even after delivery, everything is normal. So you have to cope up, help her cope up with her situation of taking care of the baby, because that is when she maximum needs. Till now, she knew what to do and she would have managed. Now she needs that life is there with her, and she has to 24 hours see to that baby has drank, baby has passed urine, motion, everything. So this tension too much for her to take. So cope up, talk to her different things. Don't ask her what you have eaten, what you have drank. She knows that. You have to talk to her different things, make her mind work again to back to what she was working, and get going and make her get going. And it is not that no, I had delivery, so now 2 months I will not get up from the bed. Make her go for a walk, give her some me time where she's away from the baby for at least half an hour to 1 hour in a day, and she can have use her time for herself. Give her a good sleep, and at the end of 2 months, let her start her exercises so she's back to her original self before. And this will help her get her to the postpartum period. So now we have delivered, we have children, we are going good. Periods have again started. So now contraception is something very important. Contraception means spacing between children, or spacing from the for the first child even. So spacing between children very important. At least 1.5 to 3 years is a good time to space. Okay, so between if it's a vaginal delivery, 1.5 years also is fine. If it's a C-section, 3 years is also enough. So 1.5 to 3 years is good time to space, because the first child also has to accept and take the second child as part of his. And when the child is overgrown, 7 years, 8 years, 10 years, it becomes little difficult, because that baby then sees the next baby as different. Okay, so it is always better to space the two pregnancies with appropriate time. So this is average what I told you. Everybody has their own priorities, so they can space. So for contraception, there are few things which can be used. When you are breastfeeding, then barrier method with condoms is enough. They give 90 to 94% protection. But otherwise, there are while breastfeeding, progesterone only pills, or not breastfeeding, you can have the regular pills. The regular pills have to be taken daily, no missing of the pill. They don't have immediate side effects, maybe some gastric or headache for a month, which settles down. Late side effects depends only if you have migraine, um, uh, this convulsions, fits, breast cancer in parents, stroke or paralysis in parents. If any of these history, you need to talk to your doctor to see whether you are a good candidate for taking the oral contraceptive pills. Then other methods of contraception will include injections, which are taken once in 3 months. The only problem they cause is that irregular periods and absent periods after 2-3 doses of injections. But you can take for a year or two and drop it. The fourth method is intrauterine device. It can be a copper T or a progesterone-based intrauterine device. Both depends on what you prefer at or for how long you need a spacing. So all these based contraception. There are many patients who feel affect my health. No, it will not. Appropriately talk to your doctor which is best for you and use it. There are a lot of couples who will come with not use contraception because there somebody has told them it's a myth that if I use contraception it is bad, and they come with repeated abortions. Repeated abortions are worst. They are going to you are taking big anti-hormone tablets to kill that pregnancy, and hence it is better to avoid a lot of abortions, rather take a contraception rather than going on doing abortions. Now plan your pregnancy in such a way that you don't land up into abortions. Otherwise you have to see your doctor correctly and me and do a proper abortion so that you don't land up into infections and all those things. So these are things. Better use a contraception to avoid abortion as much as possible. Up to 7 weeks, abortions are possible with tablets. Up to 11 weeks by surgically cleaning it up. Beyond that, no, unless there is anything major. So this is how now you cross your first child, you did contraception, you got your second pregnancy, that is also done. Now life is going on and you've reached 35 years and above. 35 to 45 years. 35 to 45 years, what all can come in? Again, some infections which needs to be dealt with, weight loss things to maintain your good weight. Then you can land up into suddenly some cyst or some fibroids or overbleeding. These are the few problems which land up. So cyst means any ovarian cyst can come in. There are 100 types of cysts. Need to see your gynecologist, get a scan, ultrasound scan done, and see what type of cyst it is, what management need. There are some type of cyst which doesn't need any management, will go off in few months. There are some which may need hormonal tablets for few months or years. There are some which may need a surgical removal, laparoscopically or open. So this all depends on what has come. There is no screening for any other cancers of women like ovarian or uterus or anything. Now, so that then there are very commonly we see that you've done an ultrasound or you had some pain and you did a period pain and then we land up into seeing fibroids. What are fibroids? Fibroids are small tumors of the uterus that will slowly grow till you reach menopause. But unless the fibroids are too huge, like they are pressing onto the urine bag or urine tube or causing any severe back pains, which is so big, like 10, 20 centimeter, which is pushing onto the backbone and causing pain. Anything like this needs to be treated. But otherwise, you don't have to follow up a fibroid. You just follow up when you see it for the first time. If you see a fibroid for the first time, you follow it up and see it back in a reassess it on a ultrasound scan 3 to 4 months later. If it remains almost the same time with minimal difference, then there is no follow-up for fibroid unless they cause any symptom to you. The fibroids do not continue to change to cancer in later years, but they remain there. So unless they are causing any problem, they need not be handled. Then what else we see with age? We see adenomyosis or overbleeding. Adenomyosis is when the lining of the uterus gets deposited into the main wall of the uterus. So they every monthly the periods will be heavier, painful. All that needs they are medical management for it. So everything comes with management. See your gynecologist to find out what is the best way of treatment. Now, at this point, I would say that any bleeding, any period which is coming 10 days late, 15 days late, or within 2 months, nothing to be done about it. Because now pregnancy is done, you are not looking into pregnancy, you are looking into protecting the uterus. So, to protecting the uterus, up to 2 months period will come. Any period which is little late is okay. Little less for once or twice is okay. But if the periods is overflowing or it is coming very, very fast, you need to see a gynecologist to find out that there is no other problem to it. So that is what is um, these bleeding problems need to be examined and reassessed. Now you have crossed 40 years. So what is the next screening test in your line? That is the screening test for breast cancer. So after 40 years, every year, every woman has to do ultrasound bilateral both the breast. So ultrasound breast is mandatory yearly after 40 years till you are arrived. That is alive. That is the second screening test other than cervical cancer screening. That cancer screening can be done. That is breast cancer. So from 40 years every. Now, if you have a family history of mother, sister, father, sister having breast or own sisters having breast cancer, then the screening change if this other people's cancer is early. So if your mother had a cancer at 40, then your ultrasound screening of breast starts at 35. If your mother's had a breast cancer at 35, then your screening starts at 30. But if it is after 50 years, then we do not expect it to be a genetic condition. Okay, so regular screening from 40 years is what? So from 40 years, screening for breast mandatory with ultrasound breast every year. Mammography once in 3-4 years is enough, but ultrasound breast is there from every year. So now you have also crossed 40, you've crossed your thing, uterus is going fine, breast is going fine, children have grown up, you are also exercising, doing good. Now you cross 45 years. So from 45 to 60, what are you looking at now? So from 45 to 55, first thing is, only thing is menopause. So the average age of menopause is around 51 years. So plus minus few years. So some people may have plus minus 2 years or 3 years up and down. But 51 is the average age of menopause. Now before uh, menopause, there is something called premenopausal problems. So premenopausal problems is something say like PMS, premenstrual problems. So every time you get your, every month you get your period, maybe 2 days before or 2 weeks before, you start having breast tenderness, breast engorgement, mood changes, bloating. Some may have mild headaches, leg cramps, all these. So these are symptoms which come in pre-period. Not everybody gets it. Not every time you get it. Some, so the patient may say, all these years I never had some. Now suddenly how PMS starts? So it's not like that. It can start at any time, end at any time. PMS. So PMS is something which needs to. So same thing is premenopausal. Premenopausal also, before actually getting menopause, 1 or 2 or 3 years, you may have these changes which may or may not trouble you. So like some mood changes, depression, anxiety, breast engorgements, heaviness, headaches, mood changes, or urinary symptoms, frequent urinary infections. So all these things are premenopausal problems like a PMS. So how do you treat both of them, PMS and premenopausal problems? How do you treat? So you treat only when these problems affect the quality of life. When they do not affect your quality of life, you do not need to treat them. Only when it affects. How do you know it's affecting? So I always say a patient has come to me. Okay, so a person has come to me. She comes with 2-3 people come. One person has come to me saying that she did a health checkup and she's come to show the health checkup reports. Then she shows me the health checkup report, everything is fine, and then she asks, so, doctor, I have this premenopausal and pre-PMS. She'll explain her symptoms the same way. These are the symptoms. So this PMS or premenopause. Do I need to treat her? Actually, I don't have to because she never came for that symptom. No, it's not troubled her. She happened to see me and then she said, okay, that is also there, so treat me if you want. Right? So unless so they are not affecting her quality of life. So other patient comes to me, she has nothing else. She is like, I have this, she comes, I have mood changes, I have the premenopausal problems or PMS problems. She comes with all these problems and price. So then definitely she needs treatment because it is affecting her quality of life. That is why she has walked into my clinic. That is why she's come and told that these are the things, and hence it is definitely required to treat her. So how do you treat the PMS and premenopausal problems? The first line of treatment for this is non-hormonal medications. So there are a lot of non-hormonal vitamins which add on and help you with these symptoms. So if you take those tablets, it works and it will bring down your symptoms by 60 to 70%. Now, second line of treatment, if this doesn't work, then the second line of treatment comes to about um, hormonal treatment. So put on hormones to help her get her out of that. That works out. Third line of treatment, antidepressants are there. Fourth line, surgeries are also available if you reach to that level. So that is the treatment of premenopausal. Now, if now you have reached your menopause. So from menopause, from 50 years, what you have to do is most important thing. Till you reach menopause, your ovaries were correctly releasing all the hormones. These hormones were helping you to avoid any heart problems and bone problems. So even if your cholesterol was high, you were protected by the ovaries or ovarian hormones. But now that protection has completely gone. So you are at highest risk of getting heart problems than men after menopause. So you would have heard 25-year-old men having heart attack, but we've not heard a 25-year-old girl having heart attack, right? 25 for like 30, 35 also, we've not had heart attacks. Why? Because the hormonal protection is so much that we are well protected till we reach menopause. But now you reach 50 plus and you are 50 to 60 years, so your protection is gone. Now it is on you to protect yourself. Understood? So protect yourself. How do you do? By having enough calcium supplements. So after 50 years, calcium supplements become part of your medication. Calcium supplements and a good exercise level to have a good blood flow to your heart so that the heart is taken care of. So there are three major vessels which everybody does angiogram, angioplasty to take care of the three vessels. So even if the three vessels are blocked, if your exercise levels have been so good that there are small, many capillaries which will supply the heart. So even the first one is blocked, the capillaries are supplying. So the heart attack is less chance. So exercise level plays a big role here. That is what is required to increase your lifespan with a good heart. So that is, so you start protecting your heart and bone, and then take care of your, so if you have postmenopausal changes which is affecting your mood, anxiety needs to be taken care of. There are always non-hormonal and hormonal medications available to take care of you. Go to where hormone replacement therapies are available, which can be taken to help you protect from many of the problems. So that is menopause, and then you need to continue your um, um, screening. So now you cross 50 and definitely your sugar, blood pressure, everything needs to be monitored. So regular health checkups, heart, breast scans and pap smears continue to be part of your lifestyle. And beyond this, beyond 60, for us to have a good healthy lifestyle, again the most important three things that are important is a good diet, uh, averagely good exercise and a good attitude takes us through after 60 to have a good and healthy lifestyle. Thank you. That is all it is. In case you have any questions, I will be happy to answer. So I'll stop. I didn't. Huh?